Mums enjoying their babies and toddlers in East London.
Is it nice?
But when you ask about going into hospital, there's a feeling that having a good experience is down to chance.
So I've been lucky, but I've heard a lot of negative stories. I know a friend of a friend ended up giving birth in a corridor of a hospital because there was no beds.
The main thing that was hard was, every time we went to an appointment, you're seeing someone different and no continuity of care.
They try to do things by checklist. It's very strict. And if you want to go outside of that, or you're questioning why they do it like that, that's when they completely shut down.
The Care Quality Commission says too often mothers are not heard. It inspected more than 100 trusts and says the majority were not safe. Women were not triaged quickly enough, pain was not managed, and there was a lack of life-saving equipment. Without action, it says, there's a danger preventable harm will be seen as normal. Dion is Niala Kidane's third child. In hospital, she stopped feeling him move. She says she was telling staff something was wrong for 6 hours.
They've given me the little monitor to click on to make sure, whenever I do feel movement, to click on that. And now, throughout the whole time I've been staying there, I've not clicked it once.
By the time the hospital decided to do an emergency caesarean, Dion wasn't breathing.
The first time I looked at my son, he was so floppy. You can see that he wasn't crying. He wasn't his own colour. And then they rushed him to put, CPR on him and everything and try to get him back, put oxygen in him.
Afterwards, they realised Niala had had a placental abruption, which was depriving Dion of oxygen. The delay delivering him caused neurological damage and vision problems. University College London Hospital said, we apologise to the Kidane family for their experience, and we acknowledge the distress this has caused. An independent review of the family's care has made recommendations for improvement, which we've implemented. There's been scandal after maternity scandal stretching back decades. 201 babies and 9 mothers died through failings at Shrewsbury and Telford NHS Trust. 15 years after her baby Kate died in the Trust's care, Rhiannon Davies says the Care Quality Commission has not been tough enough.
The report in itself is relatively robust, although unfortunately the CQC has an awful lot to answer for because we haven't got here overnight. They are the regulator, they are the person, the body that stakeholders like me, patients, look to for confidence in a service. And if they're failing, if they're telling us that all's well when it isn't, as they have been in the past, they're part of the problem.
Former midwife Donna Ockenden published her damning review into Shrewsbury and Telford 2 years ago. She's dismayed that change in England's maternity services she says she was promised hasn't happened. If several scandals and hard-hitting reports don't change the status quo, what will?
So I think that what we need to look at is the fact that following my March 2022 report, the immediate essential actions were fully endorsed by government. The then Secretary of State Sajid Javid said change would happen swiftly. In the chaos of multiple Secretaries of State that followed him, nowhere near enough was done. And I think now what we have to do is draw a line and say enough is enough. We're not going to tolerate this poor level of care anymore.
The Conservatives told us maternity services were a top priority, that it had invested in safety and secured money for more midwifery and specialist clinical training. The new Health Secretary, Wes Streeting, has called the inspector's findings a cause for national shame. NHS England admits many women's care isn't good enough. The question is whether this will be the report that actually creates change.
Well, with me now is Jill Walton, who's Chief Executive of the Royal College of Midwives. Jill Walton, when you look at Jane's report there, preventable harm normalised, a pattern of failure across the country, shocking, but kind of come as a surprise to you.
It is really shocking and very sad, some of those stories. It's not a surprise. Maternity services have been in a failing system for a long time. midwives and the wider maternity team have been calling out for change, investment, attention. It's really not acceptable that women and families are having such poor care and that staff are working in such awful circumstances where they're so frustrated that they can't give the care that they know they want to give.
I'll come back to the staffing and the investment in just a moment. But do you agree that a Shrewsbury and East Kent and Nottingham, all places where major maternity scandals have happened, do you agree that those incidents could happen across the country, anywhere in the country?
Well, those inquiries showed that there were some consistent issues from the CQC report, and certainly there are things that midwives and the maternity teams have been saying are a problem for a long time. So voices haven't been heard from women, from the staff, and that investment, that support and that attention just has not happened in the way that it should.
And when you look at that headline statistic, 2/3 maternity units just not safe for women. If you're a woman waiting to give birth now, or you're thinking about having a baby, I mean, would you be worried about your own family giving birth in those places?
I mean, I think that they have a right to worry, but what can they do about it? And I think this has got to be, as Donna said in her report, enough is enough. And how do women and staff come together to say that very, very loud? I think if there are women watching who are pregnant, who are under maternity services and they're worried, I would advise them to go and talk to their midwife, ask the questions about what is on offer for them so that they feel reassured now, because that's really important.
So raise the alarm, in other words.
Yeah.
I mean, I will come back to the money issue and the staffing, because that's clearly at the heart of the problem, but it's not the only answer, is it? Because you're saying raise the alarm with midwives, but the midwives that there are aren't always listening to the women who raise concerns, are they? Do you accept that?
Yes, and we talk to midwives all the time about the time they have to listen. One of the things that is really important is being able to have the time to build a relationship with women. Once you build a relationship, women will often tell midwives things they need to know so that they can provide the very best care to them. They tell us they haven't got time to do that in a good way, and that's really worrying.
So that does come back to staffing.
Yeah.
I mean, how short are you? How much money is needed to rectify this problem in the urgent way that the CQC says is needed?
Well, there's about 2,500 midwives short, although there has been a small increase recently, which is welcome. But because it's so stressful for midwives to work in maternity services, many of them leave the profession. So keeping them is absolutely a key issue.
So investment is among the urgent action plans proposed by the CQC. But Keir Starmer, the Prime Minister, has made clear there won't be more money for the NHS without reform. What do you make of that?
I think that's a real challenge, because I think we've got a major problem in to put right many, many years of poor investment and poor support for maternity services. Where Streeting says that maternity safety keeps them awake at night. It absolutely keeps us all awake at night. And we are really urging the government to put maternity services as a priority in NHS reform.
Well, so given that, there are lots of services saying we're the priority, give us money, how do you argue this to the top of that list?
Well, I think it's about trying to raise the profile of women's services and how important is, and maternity is part of that. In the recent investigation into the NHS by Lord Darcy, women's services are not even mentioned in the report.
Why is that? Why?
Appalling.
But why do you think that is? That, this is a life and death issue.
It absolutely is. And I think, a lot of, people who run big NHS services don't recognise the importance of women's services, maternity services, think it just happens. But actually it has to happen safely and it has to be right. And if you get it right, there's something about, public health and the future health of the population if it is right at birth. And that's so important and is often missed.
I mean, finally, you heard in Jane's report there criticism that the regulator's not robust enough. How do you want the regulator to hold the NHS to account, to hold you to account?
Well, I think the regulator has tried. Sometimes they use inspectors that haven't got experience of maternity services, they've got experience of the NHS. It's really important that people know what they're looking for so that they can ask for the right things.
Jill Walton, thanks very much for joining us.